So today we're going to talk about what not to do if you have back pain. So if you're noticing that your pain comes time and time again, and it's getting worse with each session, we're going to talk about like why this happens, as well as what not to do and why that's the case. And then we're going to give you some tips on how to start getting some relief today. So the biggest thing on why your pain starts happening in the first place is it's things that we're doing throughout the day cumulatively through time that's given us problems. So what do I mean by that? So we do 3,000 to 4,000 bending forwards every single day. I mean, we're sitting in front of a computer and our spine usually is a little bit more flexed. We come home, we sit on the couch, we watch TV, we're cleaning and we're bending, we're picking up things on the floor. We're constantly bending forward, and that is a problem. And so if I think about what happens is, if we think of like our finger as our spine, and it's the finger pulled back is basically like similar to us bending forward. So our joints are in a position that they don't really like being in. They're not in its normal resting position. So when we pull our finger back and we hold it there and we do it 8 hours a day after day, year after year, we're going to have some issues within that joint. And what happens is as we get older, we tend to not heal as quickly. It's just part of what happens as we get older. And so then we hang out there for, a full day, we come out of it, and our body has to heal from being in that position. And then what happens is it doesn't fully resolve. And then we go back into it, and then it doesn't fully resolve, and we go back into it. And eventually one day you wake up and you're like, why am I stiff? Why do I hurt? And that's a problem. And so one of the biggest things that we do that we need to stop doing is bending forward. It's the number one thing. But what we always do is we want to bring our knees to our chest. We go to physical therapists, and the first thing they give you is bring your knees to your chest, and you're wanting to bend forward to stretch those muscles. And honestly, like the muscles are a symptom because of something that's going on in the spine. So if we think about this is our disc, and we have rings that go around these discs that really kind of protect everything. And what happens is if when we are bending forward, we're basically putting pressure on the front parts of these discs, and it's moving the gel. As we get older, it becomes a little bit more particle filled, but we're moving it to the back. And so when we do that and we hang out here for a long period of time, and then we stand up to reverse that direction, we have material in the way. And that's what makes us feel super stiff, like we're 80 years old standing up, because we can't reverse that direction because we've been like this for a while and we have material that's kind of stuck in the back. And so that's one of the biggest things that happens when we're always constantly bending. We want the spine to be in a good position, so when it takes the load, it can take the load evenly, not unevenly, because that creates a lot of our problems. And so these rings that go around these discs, think of them like if you had an ankle sprain and you twist that ankle to put pressure on that ligament that's damaged, it's going to hurt. And eventually these rings start hurting because we're constantly pushing, the material into the back of this essentially, and it's causing pain. So every time you do this, now you start hurting, and it creates those muscle tightness protecting it. So what are some of the things that we need to do? We need to start reversing that direction. We need to start bending backwards to reverse it. And you're going to be super stiff doing this. And that's normal at the very beginning. But as you keep on moving and bending backwards, whether you want to stand up and just start arching your back backwards a little bit, and then going a little bit farther and a little bit farther, doing this like 10 times, 3-4 times throughout the day, or even just taking a towel roll, rolling it up and lying on your back and putting it underneath your back so that back starts stretching and you're moving the material in the opposite direction. And that'll start making you feel a little bit better. And that'll start moving the material away from the area, and our body can heal because it has a blood supply around the outside of those discs. So you will have healing that happens from that, to where you won't notice your pain when it comes back, when things have started healing. But what happens is we don't know what we're doing throughout the day that's creating some of these problems. And it's like, think of a wound on your arm and stabbing that wound. And we're just stabbing the wound, and then we stop stabbing the wound and we start feeling better. And then we stab the wound, and then we stop stabbing the wound and we start feeling better. And it's like you're constantly in this cycle of having pain and not having pain and having pain. And that's essentially what happens with our back, is that we aren't sure what we're doing that's creating some of those issues. And we're getting into positions and postures that are irritating the back. and those bending postures that are irritating those back. And then we stand up, we start moving around, we start feeling better. We start going, oh, I'm going to stop doing this, or I'm going to start standing with working because I feel better when I stand. And you'll do activities that make you feel better, that you have enough healing that happens. Then you go back to your activities that make you feel worse and you start hurting again. And this is a cycle that we go through all the time. It's also the number one reason why going to a doctor and they have, and you end up having surgery, you aren't sure what you did that created the problem to begin with. And all of a sudden you go back to the same activities that created that issues. And that's why people have a second surgery and a third surgery, because they don't know what they did. So the number one thing that we can stop doing is we need to stop bending. We need to stop bending. And I know you want to bend because you want to stretch those muscles, but the bending is creating more issues by pushing everything to the back. We need to start reversing that direction. And when you start reversing that direction, you will start noticing that you're going to start getting some relief, whether you stand and do some standing extensions, or you'll do a towel roll, put it on your back and lie on your back. So those are the biggest things that you can start doing now. And when you start getting that, everything starts healing, those muscles will just release. Again, the muscles are the symptom. So if you're wanting more tips and education on something like this, my name is Stephanie. I'm with Empower Physical Therapy, and we help chronic pain patients get their life back without having surgery or injections. So make sure you subscribe to our channel to get more great education information that we put out weekly like this.